Omicron. Now, that's the name of the latest variant of concern according to World Health Organization, as my colleague Yeon-sung mentioned earlier, and so far it has been reported in at least 13 countries. Now, there have been no reported cases here in Korea, but authorities are on high alert as they are already battling a resurgence in infections amid the country's exit strategy from the pandemic. For more, I have Dr. Kim Seung-taek from Institute Pasteur Korea. It's good to see you again, Dr. Kim.
Good afternoon.
I also have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
Dr. Kim, we'll start with you then. We are entering week 5 of our exit strategy. What are your thoughts on our current COVID-19 situation?
Well, as mentioned, we are on the 5th week of the phase 1, sort of just living with COVID-19. We have actually spent 4 weeks of running the phase 1. And then so far we have witnessed some increasing number of the number of just confirmed cases of COVID-19. Which was actually just anticipated when we actually start the current living with COVID-19, and then the number of also just severe COVID-19 patients also increased. This is quite just concerning, and then this level of increase, I think somehow just our government, also some experts actually have not just anticipated this level of just increasement. And I think maybe with some further the measures in terms of governments, the oriented just the initiated measures, that maybe this trend will just continue for a while.
Right. And Professor Kim, as Dr. Kim has just mentioned, the number of severe cases is a source of concern for authorities here. And having said that, what can you tell us about medical capacity at your hospital?
The hospital that I work with have a special ward for highly infectious disease, and also the pandemic, it was saturated. There was no real bed. If somebody comes out, there's already somebody waiting for the bed. So it's been saturated for a long time. And from time to time, more patients are waiting in the emergency department. So we have to shut down the emergency department from time to time. So it's a problem for patients without COVID. They have to visit the emergency department, but they cannot enter that area because of this situation. So we have to disinfect every time if there is a confirmed cases, and we don't have enough manpower to hold all those confirmed cases. Well, short-term plan, I would say that we have to continue all the measures that we used to do, like social distancing, booster shots, and I think we need to more facilitate the network of transferring patients. I mean, we used to have that. We have this network sending a patient from hospital A to hospital B, but now I think we need a wider network of transfer from province A to province B. It's already happened in Germany. They transfer by airplane or helicopter to an area that has less severe cases. Long-term plan, well, I think humans are a creature of oblivion. They forget. So current needs are forgotten after years. So if there's something we need right now, that should be prepared even in non-pandemic times. And I would say that there will be ICU medical professionals, ICU facilities, and the reason why we have less of this kind is because of financial issues. So I wish that we can have some kind of support in that area so we can be prepared for the worst.
Right. And staying with such countermeasures, Dr. Kim, these measures are also being addressed at an extensive meeting on this Monday afternoon as we speak. And some of these plans include limiting the validity of vaccine passes and also expanding their requirement among teenagers. What are your thoughts on this?
Well, I think also overall, just the aim of this sort of just living with COVID-19 is that actually we do not care much about now just the total, just the confirmed number of just confirmed cases, but we are actually very much concerned about the number of just the severe COVID-19 because we don't want to just overwhelm our just the healthcare just systems. And then at the same time, we are actually not just, we cannot actually ask for some sacrifices from certain groups of our society, for example, like some the small business owners. So then I think overall, my personal expectation is probably just to maintain the personal, just the current measures, but actually just assessing some very individual just factors that could just affect the our just a public some other public quarantine measures. So that may be, I don't know how possibly we can just assess each individual factors, but somehow that would be just assessed individually, and then which the parameter can be actually just change it to just change the current trend of just transmission right now.
Right. And Professor Kim, what are your thoughts on imposing a circuit breaker?
It depends what does it mean. If we activate some concept of a circuit breaker, it will have a big impact on controlling this fourth wave. But what price we have to pay for that? So I would say that most of the hospital will see severe cases, and they are more than age 60 and plus, with some comorbidities. So I think we have to go back to the basic. I mean, get booster shot and wear mask, avoid spaces with poor ventilation and strict social distancing, hand hygiene, all the basic. Actually, it's very sad that we don't know exactly why we have this kind of high numbers. And if we are not planning to activate a circuit breaker, surge will continue for a while, and we need to look back what is going wrong and what we are missing, and figure out what is not followed properly. And that's going to be some key issues for some weeks.
Right. And efforts to fight a resurgence, of course, in COVID-19 cases are also taking place over in South Africa, where researchers recently identified a heavily mutated variant that is currently fueling much global anxiety. For more on this, I have Dr. Richard Lessels at the University of KwaZulu-Natal live on the line. Dr. Lessels, it's been a while, and it's a pleasure to see you again.
Hello.
Let's begin then, Dr. Lessels, with a few words on the rebound in COVID-19 infections in South Africa in recent days that some observers are linking to the newly identified variant Omicron.
Yeah, that's right. We've seen a very rapid resurgence in cases in one particular part of the country, in Gauteng province, which is around Johannesburg and Pretoria. So it's the kind of most densely populated economic hub of the country, with a young population. And we've seen some outbreaks in universities and other higher education institutions, and that's then spilled over into the general population. And we can say with some confidence now that seems to be driven by the Omicron variant. And so essentially what we're seeing is the start of a fourth wave in South Africa, unfortunately. And we can see that now starting to spread to the other parts of the country.
How has this latest resurgence, Dr. Lessels, affected perhaps a number of severe cases in South Africa?
Yeah, so that's really the critical question, and unfortunately at the moment it's a bit early to tell, and that's partly because, as I say, this initial resurgence in cases has largely been amongst the younger population, the university students and similar age groups, and that's what we often see in many parts of the world at the start of a wave, that it's often the younger population who are the mixing more, the more sociable. And so, of course, they are at lower risk of being hospitalized and dying anyway, regardless of vaccination status. So we need a bit of time to really understand the effect on hospitalizations and deaths, and that's really one of the critical questions that we're going to be addressing over the next couple of weeks, and particularly if this variant is able to break through the vaccine protection to some extent. We need to know, does that extend to breaking through against severe disease or just against the kind of milder forms of infection.
Right, and those are answers we don't know at the moment. We need to wait for the evidence, right, Dr. Lessels?
That's right. We need to wait and see the data and be clear. There's lots of anecdotes at the moment that have got a lot of attention over the weekend, but from South Africa, from clinicians on the ground who are seeing some mild cases predominantly. But we've tried to caution against kind of taking that as too much at the moment because as I say, this issue of it's the younger population initially, and you'll be aware there's this time lag between infections becoming severe, needing hospitalization. So you need time to see it in the data.
Right. And Dr. Kim, the Global Health Body, for its part, was quick to declare Omicron a variant of concern. Could you tell us a bit about this?
Well, this was quite unusual, I mean, compared to some prior variant concerns. But the sort of just the WHO classification of this, the variants is actually starts with the variants under some monitoring. And then this actually develops into the variant of interest. And then the final stage is a variant of concern. And in this way, that we kind of just assess or just classify the sort of just potential severity of this coronavirus, the variants. And then this is actually based on the number of just factors, including some potential some transmissibility, and then some detrimental or some epidemiology, and then virulence, and then some public health measures, and also including some diagnostics and the vaccines, and also some therapeutics available. And then for this vaccine, as well, this many just actually reported just over just the 30 of just a mutation, and this is some of the mutation actually known just a mutation based on the some prior just variants, and then some of them are not unknown, and then it's kind of just a combination of all those things. So that's why this is kind of one of the reasons why we are actually concerned about this the variant.
Right. And Dr. Lessels, as you mentioned, studies are currently underway and we need to wait for those answers. But based on what you know thus far, what can you share with us about Omicron and the risks it poses?
I mean, I think what we're seeing is that it's spreading very rapidly. And one of the key things to understand is that in the context of South Africa and Gauteng province, it's spreading rapidly in a population that we believe has quite a high level of some immunity. Now, that's a combination of immunity from past infection with the virus and from vaccination. The vaccination coverage is not high. It's only about a third of adults are fully vaccinated. But because of the devastating waves of infection we've had, we think that we have quite high levels of immunity. And so what that's telling us is that this virus is still able to spread very efficiently through the population, despite that level of immunity. And that's what makes us concerned about this combination of the ability to evade parts of the immune protection that we have, and that it's a highly transmissible variant again. And that gives us concern because even if the protection from the vaccines holds up well against severe disease, this virus, if it spreads efficiently through the population, will again be able to find the people in the population that are not yet protected and that are still susceptible to severe disease. And that's a particular worry throughout the region, throughout Africa, where the vaccine coverage is extremely low, much lower than here in South Africa. Only 7% in Africa as a whole are fully vaccinated. And so we have a big concern about the possible impact of this across the continent.
Right. And talking about possible impacts, Professor Kim, what are your thoughts on the possibility of Omicron rendering ineffective our current vaccines?
Well, the mutations are found in S protein, and S protein is the key factor getting infected. And I think we already know it's highly transmissible, and it's going to take some time and meticulous study to make a conclusion whether it is more virulent or not. And if I review about the Delta variant for a while, because I feel like a deja vu. When first we faced the Delta variant, everybody was talking that whether it's going to be more transmissible, was going to be more severe or not. And yes, Delta variant is more virulent for unvaccinated persons. If we compare with Alpha variant, they say you have 2 times higher hospitalization rate in Delta variant infection. The data came from UK. And how about the the unvaccinated people have higher hospitalization, and for vaccinated people, they say there is a breakthrough infection with Delta variant, even though you got vaccinated. Transmission is possible, but they say the period is shorter, so you have less chance to spread out. And big pharmas are not preparing to sell a vaccine for Delta variant. They keep on with the original virus. So what's going to happen with Omicron? We don't know. But I heard on news that Novavax is planning to make a vaccine for Omicron. But it's too early to say. And I think we should continue with all the vaccines we have right now, and all the medications, we have to use it.
Right. And like Novavax, actually, Dr. Kim, vaccine makers like Pfizer and Moderna have also claimed that protection against Omicron may be available early next year. What are your thoughts on this?
Well, depending on what kind of the vaccine technologies we are using, the speed of just manufacturing the new vaccines based on this variant is just possible. For example, mRNA-based vaccines, including the Pfizer vaccine and the Moderna vaccines, can be very rapidly just implemented, because basically we are actually injecting just the information, the genetic information, to just produce antigens within our body. But however, in the case of the Novavax vaccine, that we actually inject the proteins. So that there's actually, simply speaking, there's an additional layer of just the protection, just the production procedure in the case of the Novavax, just the vaccine. So theoretically, just the mRNA-based vaccines can be made very quickly compared to other just the platform technologies.
I see. Meanwhile, Dr. Lessels, back in South Africa, what efforts are being made by authorities there to counter Omicron?
We heard the president address the nation last night and update the nation on the response. Really, what they're pushing and taking the opportunity to do is to really push the vaccination program again, and to try even harder to engage those that have not yet come forward for vaccination. And that's important because there has been stalling in the rate of vaccination in South Africa, and there are still many people unprotected. There will also be a program of additional doses and booster doses for those most vulnerable, the immunocompromised and the older age groups. In terms of the other public health measures, it's as my colleague said earlier, it's all the basic public health measures that we know throughout the pandemic and that we know are effective. It's trying to reduce the mixing, it's trying to reduce time in poorly ventilated spaces. We have consistent mask wearing. And at the moment, in terms of kind of stricter regulations, they're taking a watch and wait approach, and to see how the numbers evolve, and particularly to see how much pressure the health system comes under, and the health system all around the country is now being again prepared for another influx of hospitalizations, unfortunately.
Right, and our best wishes, of course, to those on the front lines of this fight against the pandemic, even in South Africa. Dr. Lessels, as always, thank you very much for your thoughts. Professor Kim here in the studio, thank you for your time. And Dr. Kim, thank you for your insights.